I'm Dr. William Stiles. I'm the prostate coach, and I'm here talking today about BPH, or benign prostatic hyperplasia, common condition that affects up to 40 million men in the US. It's common, and as guys get older, because of prostate growth, so the prostate grows here internally, and what happens is oftentimes the prostate will block this outflow channel, and because of that, urine won't be pushed through this area and out of the body in an efficient way. So some of the side effects you may notice are obstructive symptoms like decreased stream, straining to void, incomplete emptying, or you may have irritative symptoms like frequency, urgency, nighttime urination, leakage of urine. There's obstructive and irritative symptoms that both can tell you and notify you that there may be something going on with that prostate, but also with this bladder. These two organs function together. Now the bladder fills with urine, it starts contracting, and when it starts contracting, this external sphincter starts relaxing. Pressure in the bladder goes up, and then urine is pushed through this area and out of the body. Again, if there's blockage, which happens about 60% of men in their 60s, will have some form of this BPH with symptoms. So when you're on a treatment regimen, and let's say things are not going like you like, you're not emptying the bladder efficiently, you're continuing to have bothersome symptoms like these issues here, you may be looking at surgery, or you may be looking at reasons to have surgery. And there's about 5 reasons why you would want to have or start considering prostate surgery for your situation. Now, the first one is retention. What can happen because of this blockage of the prostate and the bladder not being able to squeeze urine through here? This bladder can fill up and just not empty, and a catheter needs to be put in. The catheter temporarily drains the bladder, takes away this blocked prostate, and just allows the bladder to drain. But if you have urinary retention where you need a catheter and there is known obstruction, sometimes that's an indication to do something to this prostate internally here, to remove or open up this channel so that urine can flow through here more efficiently. So retention is the first reason. The second reason is if there's a bladder stone. Let's say there's a big stone in here. Stones usually only form when there's been consistent retention of urine, or the urine is just not draining from the bladder, it's sitting stagnant in the bladder, and these stones can form. And so what it can tell you is obviously one, that the bladder is not emptying efficiently, but also this stone will jump up and block this outflow and make it even more difficult to urinate. So when there's a stone present, usually your surgeon will remove this stone endoscopically with a telescope or with a laser. He will remove this stone, but also at the same time, sometimes your doctor will talk to you about possibly doing something to this prostate to open up the channel and fix what is causing these stones to form, which is retention of urine and the bladder just not emptying. So bladder stone. The next thing is if you're on medication and the medications are not working like you like, or the side effects are too great for your medications, or you may not even want to be on medications. In those patients, sometimes surgery is done, again, to address the issue, fix the issue, so that they can have a better, more predictable urinary flow pattern. So that's another one. The fourth one is renal dysfunction. Again, a lot of this has to do with the bladder not emptying. Now, when the bladder doesn't empty and it stays full, these tubes from the kidneys can have a hard time emptying. And so there can be back pressure up here, and the kidneys on both sides can actually be affected because the bladder's not emptying and the urine down these tubes can't be pushed into the bladder because of the presence of urine in the bladder. So when there's renal dysfunction, that's usually an indication that, all right, something may need to be done to that prostate to open the channel, get things emptying, get things moving. So again, these ureters can empty better into the bladder. And the goal of all of that ultimately is to protect these kidneys, protect the kidneys. And then the last, if there's enlargement of the prostate here and the prostate is just rubbing on itself, you can get persistent prostate bleeding that just continues. Sometimes prostate medications that shrink the prostate will help with this, but that may take some time for it to work. If that doesn't work or you just continue to bleed, sometimes you're left with not too many other options. And so looking in with a telescope, removing that area that's rubbing on itself or enlarged, getting that bleeding part of the prostate and getting that removed again can help you start to urinate more efficiently. So 5 indications for prostate surgery. So if you're looking at prostate surgery as a possible option to open the channel to get you urinating better, these would be some reasons why you may want to start looking into that. Again, talk to your doctors. Your doctors can give you specifics of this type of thing and help navigate you along the way. We'll have another video about treatments, and there's a lot that can be done for the prostate, a lot of different procedures that are done for the prostate. Again, the goal is to help empty the bladder, empty the urine, and sometimes guys need surgery to get that fixed. So again, talk to your doctors. If this was helpful, let's say you know someone with BPH or urinary issues and you think they may benefit from hearing something like this, please hit that share button, share this with them, and subscribe. We are putting together a library of videos that should continue to help educate guys about their prostate health and wellness.